Welcome to Health Disruptor, Connecting Healthcare Innovators. A little bit about us. Health Disruptor's mission is all about connecting different kinds of healthcare innovators and consumers to stay connected on new ways of providing, supporting, and delivering care in what very well may be a new normal world. We are a team of experienced healthcare professionals who believe we need to explore, facilitate awareness, and embrace the unique and sometimes very controversial innovators who will be the key to the future of healthcare today. Join us on this journey to explore the future of healthcare now. In episode 1, we're going to talk a little bit about telemedicine and private practice providers. Effective March 17, 2020, and for the duration of the COVID-19 emergency, CMS will reimburse for telemedicine services in a broader manner than before. This means that they will reimburse for Medicaid and Medicare services in the same manner in which they do for face-to-face regular in-person visits. For state-to-state clarification on commercial reimbursement, please see as an example the Department of Health Managed Care link as an example at the end of this presentation. Where do private practices start? Well, when looking at your telemedicine program or where you want to begin, decide on what technology you'll use for video visits. Will you use a laptop, a computer? In that case, you might need a video cam or a tablet. You can use any of these, including a smartphone. Ascertain what technology your patients will have available. That's going to be most important. And what platform will you use? There are several off-the-shelf free platforms for video visits, such as FaceTime, WhatsApp, Doximity, and Zoom. Keep in mind, these technologies have only been approved during the COVID-19 crisis, and down the road you may have to look at another technology or platform that is HIPAA approved. Keep the process simple. It really doesn't have to be complicated. Choose your technology and platform. Know what technology platform is patient available. Develop a simple patient consent, which is advisable. Schedule and document your visit. If possible, use your current scheduling system and/or EHR if possible. You'll need to update your current billing system with added codes. Refer to the link and chart in this presentation. Then invoice and collect your revenue. Helpful video interview tips. Building patient rapport through telemedicine. That's the goal here. You want to encourage rapport. You want them to feel as comfortable as they would if they were in your office. So advise to have enhanced audio capability. Use a headphone with a mic, which is typically going to be better than the speaker mic on your phone, laptop, or computer. Enhance video capability. Optimize your camera position around eye level. Lighting should be overhead and slightly behind the camera. Look into the camera when speaking, letting the patient speak, answer questions before jumping in, making sure both the patient and the provider are visible enough, face and upper body, to get the nonverbal cues needed for an easier encounter. Encourage the patient to position their device to allow their hands to be free. Continue to use open-ended questions and partnering statements just as you would if they were in your office. Please see the attached service code detail example. You'll see to the far left the type of service. And in this slide, the examples are Medicare telehealth visits, virtual check-in, and e-visits. The corresponding CPT code and patient relationship with provider. Please note that some of these codes are for new and established patients, and some are for established patients only. For additional reference on coding, please see the end of this presentation and the links to CMS. The reference and resource links below will provide you with additional information on telehealth reimbursement and coding. The AMA Quick Guide Telemedicine Practice link will provide you with a nice brief overview of coding and reimbursement. So take a look at that and also take a look at the other links provided. Thank you for viewing our episode 1 today. For additional information on building your telemedicine program, please do not hesitate to contact us at healthdisruptor@gmail.com. Our website is currently under construction, so contact us at the email above. Coming soon in episode 2, Planning for a Successful Telemedicine Program, which will go into a deeper dive of the information that we provided for you today. And episode 3 will be a live interview with a telehealth program manager. So thank you for joining us, and we look forward to having you on future episodes.